I've got two questions for you. Number one, what does it cost? And number two, what is it worth? So think about this. What does it cost to go through 4 years of undergrad? What does it cost to go through 3 years of grad school? What does it cost to go get board certified? And what does it cost to become certified in something else? Now remember, cost isn't just what you paid in these situations for tuition or a registration fee. It's also your time. So time is your most expensive commodity. So 4 years, 3 years, 2 more years here, and then a couple more years here. What does all of that cost, both time and money-wise? Now I want you to think about this. Question number 2, what is it worth? Where did this get you? It probably got you here. Where did this get you? It got you where you are at now, and my inference is you're not thrilled with where you're at because you're watching me, okay? What did this get you? Anything? Did it get you more pay? No. Did it get you more clarity? No. Did it actually get you further into the mess, suck you further into the conventional model and doing what's expected? Probably. Probably same thing with any other certification. So you've got a lot of expense. What did this cost? And your payback, what it's worth, is you're here watching me because you're either confused or frustrated or burned out or a combination of the three, and you're ready to say, screw it, I need to go do something else because what I was told this would do for me, all of this would do for me, is not doing it. So listen to this. What would it cost you to spend the next 4 months taking the information that you learned here and regurgitated on a test and soon forgot, take that information and actually use it in the clinical setting? So understand how anatomy, biomechanics, neuromuscular physiology all work in the clinic and use critical thinking skills that somebody could teach you how to use so you could become a clinical expert, which was not the goal of these people. These people, this person's goal was to get you to this goal. This person's goal was to help you pass boards. That's it. This person's goal is to get you further into the medical model, as is this, and have you pay them so they can keep you there and keep you satisfied and hunky-dory to keep pushing the medical model agenda. What if you could break out of that model in 4 months, learn how to apply what you learned here, learn how to actually put it together so it makes sense, it's streamlined, you get outcomes that you never got with any of the information that you learned here because they never taught you how to apply the pertinent information. So what would that cost? If the actual dollar amount just for tuition of these things came up to roughly 6 figures, what if you could pay a fraction of a fraction of a fraction of that and get done in 4 months what you didn't get done here in 7 years? And get done in 4 months what will get you out of this and unwind what you were taught and what you were told here so you could actually be what you wanted to be, which is an elite clinician. I never met a student or a clinician that went to PT school with the goal of being a mediocre generalist that just does what they're told because that's what's expected when you're a physical therapist. So in 4 months, in a fraction of a fraction of a fraction of a fraction of a cost, an expense that you racked up here, you can become an expert in your field, a leader in your field, help people get the results they want to get as patients, and also help elevate the rest of your profession to get out of the mess that these people created. So if that sounds interesting to you, if it sounds interesting to have a thought process that you can use with every single patient and get outcomes with every single patient that you never got before, and have clarity as you move through that thought process, and have an understanding of how anatomy, biomechanics, neuromuscular physiology work because you learned how to apply critical thinking concepts that you've never been exposed to before, then you're ready to reach out to me and let me and my community of people that have gone through the process and are out there killing it now, either as clinicians who are working for somebody or clinicians that went off on their own because they wanted to do their own thing as their own business owner, and I'm working with them doing that now. So this is a continuum when you work with me. I'm going to take you out of this mess, teach you how to be a clinician, and then if you want to continue to move forward with that and be a business owner who is a clinician, I will help you do that. But the first step is you have to understand what this cost you and what it's worth, because what I'm going to give you is going to cost you a fraction of a fraction of a fraction, and more importantly, be worth every single penny, because it's going to allow you to be who you want to be, doing what you want to do, giving your patients the results that they deserve. Reach out to me now and let me know you're ready to go.